consuming more salts become more popular even amongst the general population, with more electrolyte drinks really having stronger, 500 mgs, 1,000 mgs of sodium to a group that's already consuming a lot. So curious what you guys have found with the paleo diet in terms of this high versus low salt debate.
That is probably one of the biggest things that are biggest discussions we have with people because, as you said, there's this push now that higher sodium is healthy. A lot of this belief about the higher sodium came out of two studies that showed what was called a J-shaped relationship between salt and cardiovascular health, where you saw the people who ate really high salt content in their diet had a much higher risk of cardiovascular disease. But interestingly, in this study, what you also saw was people who ate a low sodium diet had equally high risk of cardiovascular disease. And in the study, what you saw was around 4,000 milligrams a day is where you saw the lowest risk of cardiovascular disease, which is much higher than the RDA.
Mm-hmm.
So that's led a lot of people to say, look at these studies. We should be eating a higher salt content. But we address this study. There's actually another study out there that dug deep into these and found there was a flaw in them, a really major flaw. One was how they were measuring salt consumption. But the bigger one was they didn't exclude people from the study who had already been diagnosed with cardiovascular disease, which they should have done. And this is important because when you are diagnosed with cardiovascular disease, what's the first thing your doctor tells you to do?
Reduce that salt.
Get the salt out of your diet. So what was happening was it wasn't, when you look at that other side of the curve where you have the people on the really low salt diet, it wasn't that they went on a low salt diet and then they developed cardiovascular disease. It was they developed cardiovascular disease and then they went on a low salt diet.